Hello, everyone. Thank you for joining our webinar, Preventing Health Plan Revenue Loss through a Collaborative Group Enrollment IT Infrastructure. Before we begin, I would like to point out that all lines will be muted for the duration of the webinar. However, questions are encouraged and will be answered at the end of the presentation. Please submit all questions in the chat box on the top right of your screen. Our session is being recorded and will be provided to you within the next 48 hours. And with that, I'm happy to introduce our speakers. Our first speaker is Joshua Jahani, the Senior Manager with Edifecs Operations Consulting Services. And our second presenter today is Robbie McLean, Senior Director of Product Management at Edifecs. Now I would like to request Joshua to start the presentation. Hello, Joshua.
Thanks, Nader. And thanks to everyone joining on the phone today. So as Nader pointed out, we're going to be talking about preventing health plan revenue loss through a collaborative group enrollment IT infrastructure. We'll go ahead and get started. We have a pretty packed agenda this afternoon if you're on the East Coast, or this morning if you're on the West Coast, or from wherever you're joining. We'll talk about who Edifecs is. We'll talk about some of the challenges that we've identified as part of our best practices analysis from what we've seen across the industry, steps needed to solve the challenges and the problems that we've identified. We've got a really great case study for you about bringing the theory into practice, about specific examples of how we've seen these kinds of challenges be remediated throughout the industry and some of those best practices coming to life. We are also going to talk about getting started with Edifecs, and then we'll have some wrap-up questions for the group. So as Nader mentioned, please don't hesitate to submit your questions in the chat box, and we will really appreciate answering those for you. So before we get too far into the meat of the presentation, we want to take a couple of minutes and just talk about who Edifecs is. For the relatively small organization that we are, about 400 or 500 people strong, we serve over 215 million lives through over 350 of our customers. We have a substantially large footprint in the marketplace with the majority of Blues plans, almost over half of the Medicaid programs, and then nearly 100% of the top health plans. Our enrollment management solution profile currently touches and serves more than 4 million lives through our customers. We've been able to develop a seamless connectivity to federal and multiple state-based exchanges or private exchanges. We have a highly performant profile processing system for large employer groups, along with scalable enrollment processing for large and small enterprises, and then flexible rules that we'll talk a little bit more about later in the case study and some of the technology deep dives that we have in terms of best practices. So now we'll move into visibility and collaboration challenges and how that impacts revenues for health plans. The major macro challenges that we've developed and wanted to present to you today include manual processes and workarounds that impact efficiency. So when health plans and our customers think about this and when they call on Edifecs to help resolve some of their problems, oftentimes it's about this sort of front-end ecosystem that they've developed, and that's resulting in a lot of manual work to maintain compliance or deal with any sort of compliance or regulatory issues, as well as making sure that members and customer satisfaction for the health plan is met with the highest integrity. Limited visibility in enrollment activity and member fallout is a huge element for many of our key and marquee customers. Being able to enhance things like audit reporting or even start to create a story around key performance metrics and indexes that our clients can use in order to better their practices is often a struggle when they have manual processes or fragmented systems. So creating that single repository, that unlimited visibility, so alleviating the challenge of limited visibility, is essential to reducing fallout. Additionally, lack of standardized enrollment processes across different lines of business we see as a huge challenge in the industry. We have multiple lines of business that exist in the healthcare ecosystem, including Medicare, Medicaid, commercial, ACA, large groups, small groups, and being able to handle with all of those different categories of lines of business and have a consolidated system across people, process, and technology becomes a challenge for health plans that are trying to compete in these spaces. Being able to find the similarities in those environments helps alleviate those visibility and collaboration challenges that we'll get into. And then lastly, the major macro challenge that we identified and want to present to you today is that improving the efficiency of enrollment operations really is essential to that member satisfaction piece. So in this case, the team on the phone today has been in a lot of meetings where we're talking to our key C-suite leaders at different health plans and clients that we have across the nation and saying what they're focused on is making sure that if someone shows up to the hospital, if we're dealing with an open enrollment scenario and it's in early January, that they're able to receive coverage and that there isn't any sort of lack of care or interruption of care because of a visibility or collaboration challenge. And that's something that we've really taken as a lot of our motto and sort of our charter in making sure that we're improving these kinds of things across the industry. Drilling down in these challenges and really trying to elicit how these challenges accelerate revenue loss is the focus of this webinar and really why our clients call on us so often to come solve a problem. When we look at things like manual processes and workarounds that impact efficiency, we see particularly around open enrollment time period, which is coming up now, but these kinds of use cases exist and these challenges exist even outside of the open enrollment time period. But a high ramp-up time to train new resources. So when processes are fragmented and they're manual and you have to scale your operations to address these kinds of open enrollment periods when you have extraordinarily high fallouts or some kind of pain that's just felt more severely because of the high volume of enrollments coming into your system, being able to keep these kind of tiger teams and SWAT teams becomes a major focus of people working at a health plan when they otherwise could be focusing on something that might be a more strategic initiative. Unclear desk level procedures goes along with that. Having these fragmented processes that are changing all of the time requires a lot of sort of operational maintenance to make sure that resources are aware of what they need to do at all times, and those activities are constantly changing. And that costs or that creates an expenditure on the part of the health plan just to keep resources enabled. Delays in enrollment and onboarding of new members, this can often create concerns for any sort of internal auditing or any sort of effectuation that would lead to a top line or revenue growth. Being able to make sure that in the case of an NTM audit, if you're a Blues plan, or in the case of some sort of performance guarantee audit, if you're a commercial plan, or both, if you're a large health plan working across the nation, being able to have that visibility and to make sure that you're following all the key parameters that you set inside your organization becomes an important activity, and again can lead to revenue loss when you're constantly trying to make up those potential deficiencies across different business units. Self-service for groups, we've got a lot of really good information about this later on in the webinar, but as we've seen the industry grow and as we've seen really this collaboration and visibility challenge continue across the healthcare space, this self-service and automation piece is at the forefront of all of the C-suite leaders' mind, as well as directors and above at these major clients of ours, because they need to start finding out ways to have a closer partnership and really create that web of interconnectivity and collaboration that allows everyone to march towards the same goal of getting enrollees into the system and receiving care in the fastest way possible. And when that doesn't happen, that's what leads to revenue loss. Those kinds of initiatives trying to automate and create self-service opportunities become burdensome. Not most importantly, but something that is extremely important and we wanted to highlight in the presentation today was latency across operations that can cause SLA impact. So in the case that you might be looking at an audit, or even outside of an audit, when you have particular parameters that you have set and then you stop meeting them, there can be revenue losses associated with that in terms of you're looking at MLR caps that different health plans have to associate themselves with, sort of putting on Band-Aids that have to do with these manual workarounds, and then come into this impact of an SLA item is where you'll start to see a lot of these kinds of urgency get created around revenue loss at a health plan. And then lastly, the visibility piece that we talked about. We'll talk about a little more, but it's important for that enrollment activity and reducing that member fallout. So a lot of these revenue loss items have to do with administrative automation and really enhancing the value proposition of the business activities that exist at the health plan. At times, they can be associated with top-line growth and sort of maximizing that revenue, because if you're not able to get the revenue as fast as possible, then that would just be the contrapositive of the other. And we've mixed them here to sort of discuss what this checklist is going to look like in a few minutes about how to alleviate this pain. So we're going to take a poll question right here, and I'll take a pause. I'll read it to you, and then Nader will fire up the poll. But of the following enrollment challenges, which one do you feel drives the most revenue loss for your organization? So if you'll take a minute and respond to this poll now, we'll wait for the results.
Okay. Right, closing the poll. Yeah, let's see. Okay, so Joshua, we do have tied 50% for the first one, lack of standardized enrollment process across different, not the first, that was the first one, and then the second one also got 50% as well too.
Okay, thanks for that, Nader. So that's in line with where we see most of these challenges in the industry. They're usually a little top-loaded according to the list that you have in front of you right now, where when we look at the lack of standardized processes across lines of business, it's with that, it becomes that growth piece, right? Is that if you're strong in the commercial space, and then for a strategic reason, leadership has decided to move over to a Medicare or Medicaid space, being able to take those strengths and apply them to that new line of business can be a challenge. And then additionally, absolutely, and Robbie will talk more about this, that stakeholder satisfaction piece, that enhanced way of doing business and improving operational efficiency, that web of interconnectivity, whether it be on a group side or whether it be a different line of business, becomes absolutely essential, and really is where we see a lot of the innovation and the growth and the improvement in the industry going forward over the next few years. Okay, so now that we've talked about the challenges and we've gotten some feedback from the audience about how these challenges apply to their specific ecosystem, we're going to talk a little bit about the steps needed to solve these. So Edifecs does a lot with enrollments, right? We talked about the overview in the beginning, but we've generated an excellence checklist across people, process, and technology that we wanted to present to you today as a tool for really conducting sort of an analysis of your own organization. Just, and whether it be sort of a mental back of the napkin thing or whether it becomes something more formal, that's up to you. But being able to understand that from our perspective and the way we've seen many, many health plans do this across the nation, is that in terms of the people component of this checklist, it's about keeping the resources fully trained, knowledgeable, and enabled. On the process side, it's about aligning those operational goals and those operational strategies to a governance framework, which we'll talk about in a few minutes when we get into the details of this checklist. And then on the technology side, which is really kind of the Edifecs very unique value proposition, although we do touch on all areas of the checklist, it's about employing that flexible technology to support growth, enabling that administrative automation that lowers operating costs. So let's delve into the people section a little more clearly. And we have some case studies coming up later in the webinar, but we wanted to summarize everything and present it as this checklist. So when you look at people, you have to make sure that you have clearly defined organizational structures, user roles, and responsibilities. So let me talk about that just for a minute. When we've seen large health plans modernize their enrollment, they generally engage, whether it's an internal or whether they use some sort of outside consultant to do it. We've seen both, but a organizational readiness type tactic where they work with an organizational readiness team. They define the personas that exist in their current state, and then they map those to whatever modernization future state they're going to go to. And being able to do that mapping, and it's generally not one-to-one, sometimes there's operational savings or sometimes there's enhanced skill sets that they're able to deliver, that becomes part of the best practices modernization technique, and that is what reduces revenue loss. Because it's about not only that administrative automation, but about that enhancement of the skill set and making sure that people who work in the enrollment space are able to do their jobs more efficiently and do other jobs that maybe they weren't doing before. The focus on the end user, particularly for some of our clients that we've seen who may have a large amount of challenges being experienced, whether that be a lot of fallout or whether that be some accelerated revenue loss through different kinds of line of business growth and an inability to scale. Being able to focus on those end users and identify who those end users are through the previous activity of defining those personas and those user roles is absolutely essential. So this includes things like desk-level procedures, and it includes things like a technology enablement strategy, where if you are modernizing with existing tools or whether it be future tools, making sure that the people who are going to be doing that work are enabled as possible. And then additionally, KPIs. Whenever you modernize or whenever you start to alter a current state, you're going to have an opportunity to adjust your KPIs. And figuring out how you can adjust those KPIs in the most efficient way possible is part of best practices. On the process side, looking into governance models for cross-department initiatives. We've seen on the enrollment space, and particularly when addressing these challenges, oftentimes these personas that change they'll become interdepartmental. So maybe there's something that IT is sharing with business that they didn't do in the past. An example I can give you about how we've seen this play out with one of our clients is the onboarding of new accounts. So we had a client who was alleviating a lot of these challenges by sort of modernizing their enrollment and following this checklist. And one of the things they realized is that the activities that they had in their current stage were going to be shared between completely different teams in the future state. And so making sure that those kind of governance models existed to identify exactly how that was going to happen was essential really before even go live. That at the time there was a solution in the mix. So that was absolutely essential. And then in terms of business alignment with readiness teams, enrollment is fun because you have open enrollment periods. And if someone is feeling a challenge, and if you're listening to me today, I imagine you probably are experiencing some challenges, being able to make sure that the business alignment and business continuity is preserved as much as possible requires some very careful process planning. And that is along the lines with improving that operational alignment and governance. And then lastly, on the process side, based on how we've broken down this checklist, is that a consolidated and standardized process across enrollment operations is absolutely essential to addressing those challenges we spoke about only a few minutes ago. If you remember, we talked about the line of business. So if you have different lines of business that are scaling differently and a health plan is trying to address that, being able to look in terms of yourself, almost like looking inside yourself, and then identifying what strengths you can standardize across LOBs, as well as what unique instances are going to exist because of the requirements of the LOB, whether it be a business requirement or whether it be a compliance requirement, is irrelevant in terms of the checklist. But being able to identify those and then standardize them and then enable them, which gets back to the people component, is absolutely essential. Technology. So the last piece in our best practices checklist and a way to address some of these challenges that cause revenue loss is about employing that flexible technology, which supports growth and lowers operating costs. So in this space, the way we've identified it and decided to present it to you is that having that flexible support to accommodate the needs of different markets becomes the flip side of that coin we were talking about earlier when we talked about standardizing across LOBs. So having a technology that is scalable enough to either do a highly performant full file processing system or address specific needs of an FFM or an SBE, depending on what kind of market you are, if you're in a fixed market, is essential. And then cost-effective, scalable support for entry-level markets and large-scale mature markets is, again, sort of a deeper level of that, and that gets into that growth consideration and that web of interconnectivity. And we'll talk about this more in just a couple of minutes. Support for seamless integration between the automated processes and the manual touchpoints. So this is something that really can't be talked about enough, is that today, in 2016, the 21st century, technology is ubiquitous. And we are not always going to be able to automate everything. And being able to identify from a technology point of view what we can automate and then what we can enable or expedite with technology becomes an absolutely essential part of any best practice when we look at the enrollment world, specifically related to these challenges. I want to take a pause here. I have my esteemed colleague, Robbie McLean, on the phone. And Robbie, I want to give you a chance to say anything if you think I missed anything on this slide.
Thanks, Joshua. I don't believe that you've missed anything. I just want to call out and kind of stress again on some of these areas. The key thing about technology is if it's not flexible or scalable, it can result in having to stand up new enrollment channels when you're entering new markets. That can delay your entry into those markets or even make the cost of entry into that market prohibitive. Typically, force-fitting existing inflexible technology into a new market results in creation of multiple manual processes to accommodate the differences. Those same manual processes that you develop for the entry level into that market become untenable as that market grows. And so the scaling requires addition of more resources and then more resources to manage those resources, effectively reducing the business revenue derived from the increase in membership. So manual touch points, as Joshua said, will feasibly always be required for resolving fallouts and validations, receiving approvals, inquiring into questionable updates, and so on. But technology that seamlessly integrates those manual touch points into the automated process and provides visibility across the entire transaction lifecycle, spanning both the automated and manual, is key to a mature, efficient, and effective system.
That's a really good point. Yeah, thanks for that, Robbie. So with that, I'm actually going to pass it off to Robbie now, who will talk more about the theory and practice piece of this webinar. So go ahead, Robbie.
Okay, let's go on to the next slide. So our real-world representative health plan serves over 1.5 million lives, spread across multiple lines of business, including individual direct subscribers and group memberships. This includes public affordable care marketplaces and private exchanges, selling to both individual and small group markets, as well as the traditional group models for medium and large-sized groups. So they really run the gamut of all of the different lines of business or sources of enrollment information. The health plan maintains multiple enrollment channels for receiving enrollment transactions across these differing markets, which at a minimum represents multiple sets of hardware, multiple sets of enrollment transaction processing solutions, but also multiple models of the surrounding processes. Initial membership onboarding, initial EDI testing and onboarding processes, production EDI monitoring, monitoring and processing of open enrollment files, communication with your enrollment partners and your employer groups, multiple knowledge bases, and differing methods for new employee training. The various solutions also provided differing levels of visibility and reporting. Essentially, the technology left little opportunity to leverage people and processes across the differing lines of business. The health plan defined a set of drivers that would address tactical challenges, but also set them on the path to strategic growth. Specifically, improve group and member experience through accuracy of data and proactive alerts. Establish a source of truth for transaction and current member coverage enrollment that serves internal operational needs as well as external customer needs. Enhance event and metrics tracking that supports near real-time insights into SLA measurements, member touchpoint measurement scores, and the ability to audit processes. And finally, overall reduction in operational costs for the various lines of business enrollment operations teams. Go on to the next slide. So the individual business drivers were a direct result of a particular challenge or set of challenges that we had discussed on the previous slide, most of which will sound familiar to any health plan representatives attending this webinar. Lack of clear insight into actual enrollment transaction activity and time-delayed, batch-oriented reporting mechanisms that did not do enough to allow operations teams to be proactive. Subjective manual processes in disjointed transaction fallout communication and tracking resulted in inconsistent handling and prevention of scenarios that negatively impact group and member satisfaction. High support costs and group satisfaction costs associated with the new group onboarding procedures and open enrollment activities. Inability to timely address the seemingly continuous Affordable Care Act marketplace change requirements and enrollment transactions and monthly reconciliations, as well as internal changing ACA market business needs for receiving, reconciling, and reporting on financial subsidies. Let's go on to the next one. So our case study health plan, the core capabilities that they received or that were delivered by the final solution selected by the health plan focused on, number one, empowering their people through visibility that promoted proactive identification and early resolution of issues. Increased automation of business processes that were seamlessly integrated with the appropriate manual processes. Again, appropriate manual processes. Technology that provided a scalable solution that was cost-effective for the smaller individual markets, but also supported the volumes and demand of the more mature markets of this health plan. So let's go on and talk a bit about how these capabilities were delivered. So key ways that these capabilities were realized. Reduction of the total cost of ownership through a single solution that supported the varying transaction and business process needs across the differing lines of business. Ability to catch and report back to partners and groups any issues or questionable updates as soon as possible. As a result, errors were caught sooner, reported sooner, and resolved sooner. This health plan's initial launch resulted in a 40% increase in first pass rate of enrollment transactions into the core membership system. Integrated workflow provided seamless transition between automated and manual processes, including virtual elimination of the need for manual entry of enrollment data directly into the membership system, which further reduced errors that might have occurred during data entry. But more importantly, the seamless flow from manual review, correction, or approval back into the automated flow ensured that downstream automated processes were consistently applied. Increase in visibility allows enrollment specialists and operations managers to identify and resolve issues proactively, resulting in increase in group and member satisfaction rates. As a whole, their enrollment data is of a higher quality, fewer member issues, and overall improvement in key measurements, resulting in even further increase of member and group satisfaction, which is critical in today's ever-increasingly competitive market space. So let's talk a bit more about Edifecs' specific capabilities. Can we go on? So from a people and process standpoint, Edifecs provides a formal assessment service that evaluates your current health plan enrollment operations, including your current people, processes, both automated and manual, and technology capabilities, and applies Six Sigma practices to determine how to best drive down your operational costs, increase member satisfaction, and overall reduce revenue loss across your lines of business. Once the assessment is complete, Edifecs provides you with a formalized report complete with recommendations. We then work with you and your teams to ensure successful transition to approved new processes. Edifecs will provide new process documentation, targeted end-user training, and other resources to ensure successful transition and long-term realization of the improvement over the long-term span. Now, let's go into technology. In addition to people and process improvements, Edifecs offers technology solutions available in both hosted or on-premise models that can further reduce your revenue loss and increase member satisfaction. Our technology solutions can supplement existing capabilities, address a specific market segment, or supply a critical automated need, or provide a broader solution that serves multiple or all of your different lines of business needs. Core features of either our hosted or on-premise solution include configurable rules-driven transaction processes that allow a single solution to orchestrate transaction processing that may differ based on line of business, specific enrollment transaction sender or type of sender, and relevant downstream systems. For example, the differing business edits and validations applied to an initial enrollment transaction can be based upon whether it's an individual or a group market transaction, specific exchange or state Medicaid transaction originator, and the downstream membership system or vendor health plan to which the transaction will be routed. Internal operations personnel have quick access and views into their assigned accounts activity, both automated and human workflow items. Account personnel, such as employer groups and third-party benefit administrators, also have secured access and views into any alerts or notifications regarding their transactional activity. Deep visibility into individual transaction activity, status, and timing, as well as full 360-degree views of individual member and coverage information with direct links to relevant enrollment and enrollment-related financial transactions. For example, internal and account personnel, such as internal and your employer groups and TPA, authorized TPA users, can quickly identify that a member has a recently completed transaction update, or that a transaction update is in progress but is waiting for approval or correction or response to an inquiry, or that a transaction update was recently rejected and is waiting correction by the employer. Full range of enrollment features, including full file comparison for identifying maintenance updates, ability to perform enrichments and crosswalks against received data, validation against current membership records, multiple options for handling multiple transactions received for the same member, an integrated human workflow, including ability to correct rejected transactions or review and approve suspect transaction activity, and then reintroduce transactions into the automated transaction workflow. For integration with the Affordable Care Act marketplaces, additional features include full support of marketplace transaction data, including both shop and individual markets, performing monthly enrollment audits, reconciliation of monthly financial subsidies against expected amounts, workflow reviewing discrepancies and releasing automated updates into membership systems, as well as generating and tracking disputes with the federal facilitated marketplace or relevant state marketplace. Role-based security ensures that the right users have access to the appropriate information. Internal users only have access to perform functions for which they are authorized, and external users have access to only their account activities and the self-service functions and workflow tasks that have been assigned to them. Dashboards and alerts provide insight into balance and control discrepancies and aging to ensure that no transactions are lost and that issues are resolved within planned SLA timeframes. So let's go on and talk a little bit more about the Edifecs transaction lifecycle. On to the next slide, please. So the Edifecs enrollment management provides a unique transaction lifecycle that accepts transactions from any source, including your own membership systems, employer groups, state Medicaid, public-private exchanges, vendor health plans. The first point in this lifecycle is intake, which performs compliance validation and acknowledgement generation. Edifecs can support any format from a wide range of EDI 834 variations, XML formats, custom delimited flat file formats, any type of structured format that you may need to exchange with your enrollment partners. For the ACA marketplace, Edifecs provides FFM and state marketplace format support. During intake, transaction data is normalized into a common business model and organized into family coverage transactions, or in other words, subscriber-dependent actions against a specific coverage. Processing is where the line of business and target downstream membership system or vendor partner is identified, and then the relevant crosswalks are performed, automated data edits or corrections applied, and business validations against current membership data occurs. Distribution routes transactions requiring human touch points to our integrated workflow, and valid transactions that continue in the automated flow are converted into the downstream target's required format. Distribution also has configurable options for how to handle delivery of multiple transactions received for the same member. Transactions can be merged or delivered individually as per downstream system capabilities and health plan preferences. Transactions that are packaged and delivered are monitored for successful receipt by downstream systems, and based upon downstream system capabilities, Edifecs will also monitor for confirmation or notification of the system's successful or failed completion of the transaction update. If the membership system or partner reports a failure, the transaction can be optionally routed to workflow for notification and tracking. If the originator of the transaction requires a response, such as an effectuation for a marketplace transaction, or report on the final status of the transaction, the lifecycle continues into creation of the appropriate response, which is again monitored for successful receipt. Edifecs provides unparalleled transaction visibility across each of these points in the transaction lifecycle. In addition, the Edifecs solution includes an integrated member repository that automatically correlates current member and coverage details against inbound and outbound transactions to provide a complete end-to-end view of a member. Internal and external users can view current member enrolled coverage details and the relevant transaction correlations that tell the story of what has transpired against that member and that member's coverage. Edifecs member repository is populated based upon processed transactions and periodic synchronizations with internal membership systems. This repository can be used for additional validation and enrichment of new transactions, including comparison of full file records to identify changes or missing information. Optionally, clients can elect to utilize real-time integration to their existing membership systems to perform these same validation, enrichment, and comparison functions. In either model, the Edifecs member repository can also serve as a supplemental storage to hold member and coverage details that cannot be held within the existing membership systems. Our next poll question. So what we're looking for in this question is, what aspect do you believe your organization struggles with the most? Is it people, process, technology, or do you equally struggle across all of these aspects? Or none of the above?
I see the results are coming in. Closing the poll in 2 seconds. Right, closing the poll now.
Well, again, we have a 50-50 tie. So 50% of you felt that process was the area that your organization struggled with the most, and 50% felt that technology was the area that your organization struggled with the most. And process and technology tend to go hand in hand, so that's not a surprising result. Let's go on to the next slide. So from a wrap-up standpoint, some of the key thoughts that we want to leave you with. Collaboration and visibility challenges can and will lead to revenue loss. These challenges impact health plans before, during, and after open enrollment. Health plans are solving these challenges today with a strategy that's focused on people, process, and technology. We hope this webinar has been informative and valuable and appreciate your time in joining us. Let's go on to the next slide. If you are attending HIMSS this February in Orlando, please stop by our booth 6369 to learn how Edifecs is solving some of the most pervasive healthcare problems in population health management, value-based care, as well as value-based reimbursement. Now, I think we have some time for some questions.
Yes, thank you, Rafi and Joshua. We do have a couple questions. The first question is, you mentioned the 40% cost reduction in manual work for your case study. Can you explain more about how you were able to determine that?
Yeah, I'll take that question, Nader. Thank you. So that's actually a really good question. That's what Ravi talked about during the case study. We had this large plan in the Northeast that Edifecs was able to reduce the manual fallouts for a particular system by really, it was over 40%, I think, at the time. And what was really fascinating and exciting about being part of that project was that the way Edifecs addressed that was we did a very detailed investigation of the kind of rules and the kind of validations that were causing these manual touch points to exist at a downstream level. We identified the rules, and then we identified how they could be taken upstream and either rejected directly back to the submitter, automated if there was a particular kind of rule where we were able to do some sort of data enrichment or some sort of automation to alleviate the issue completely, or drop it to a much better UI for exception working. I remember in this case, the client was using a very painful sort of spreadsheet process, and the enrollment management solution was part of the discussion for this case study, and we were able to drop it to one of the workflows that Rafi was showing you earlier. So it was a very specific identification of those downstream rules, and then how we could A, automate, B, drop to a better workflow, or C, reject directly back to the submitter, so automate the enrichment or direct the reject back to the submitter, which was very exciting. And it was over an 18-month period, I think, is where we found the savings, and it ended up to a very powerful ROI discussion about what our client, in that case, the health plan, could do with that money in terms of additional investments. So.
Great, thank you, Joshua. Our second question is, my organization is very good at handling the income enrollment information, but we can't always reconcile it with our repository. Is that something you address?
Okay, I'll take this one. There's a number of different ways or methods about reconciling with your repository, so I'm not exactly sure which aspect of it that you're referring to. We can provide assistance in different ways. One, we store multiple identifiers for members and coverages, which can be added to transaction data for use in downstream system identification. So, for example, if you're working in the marketplaces and they're sending in only the identifiers from the exchange, we can add in the payer identifiers. Or if this is an initial enrollment, we can also look to see, is this a member that we've had before? Have they perhaps had coverage in the past? Or their past identifiers that we could assign to that individual and then pass it downstream. So one, we can supplement or add in identifiers that maybe specific downstream systems might need to have that weren't in the original transaction. In addition, we reconcile the transaction data against the current member information during our processing. And during that processing step, we can look up at that information in your system in a variety of ways. If the information can't be reconciled, we can also route it to workflow, where users can take a look at the information, perhaps correct identifiers that were on the transaction that were invalid, and then reroute that transaction or resubmit it into the transaction flow. We can also integrate with an enterprise master patient index service that you may have within your enterprise, and then we can call out to that, get that information, and insert the EMPI or the master patient identifiers into the transaction so that it's reconciled within your systems accurately. Hopefully that answered your question.
Great, thanks, Robbie. That's all the questions that we had. Thank you, everyone, for attending today's presentation, and we appreciate your participation and wish you all a great day and much success with Digital IT Transformation Initiative.